evening to one all present here. I, Aditi, the General Secretary of IMA MSN branch, take this as an honorary opportunity to do the welcome speech and to be the moderator for today. I would like to welcome IMA KSB President Dr. Chinivalar Sir, IMA KSB Secretary Dr. Suriraju Sir, guest speaker of the day Dr. Bharati Rajshekar Ma'am, who's the President of KSOGA, MSN KSB Chairman Dr. Padma Prakash Ma'am, MSN KSB Coordinator Dr. Vinaya Srinivas Ma'am, guest speaker of the day MSN National and KSB member Dr. Anuradha Paramesh Ma'am, Dr. Madhusudan Karignur Sir, past presidents of IMA, and Dr. Yogananda Reddy Sir, President-elect IMA KSB Dr. Veerabhadraya Sir, all senior doctors and medical students. I would like to welcome all of you for this informative session on HPV. Now I would like to call upon Vedika to do the IMA prayer. Thank you.
So I'm starting with the IMA prayer. May everybody be healthy. May everybody be happy. May everybody be free from pain. May everybody be free from sorrow. May we be healed and cured beyond every grief and lure. Thank you.
Thank you, Vedika. Now I would like to call upon Swapnil to do the flag salutation.
Good evening to good evening to everyone present here. So we, the members of Indian Medical Association, stand here to salute our national flag. Its honor and glory shall be our light and strength, and its course shall be our course. We pledge our allegiance to it and realizing our responsibility as the accredited members of this national organization. We swear we will dedicate everything in our power to see it fly high in the Committee of Nations. Long live IMA.
Thank you, Swapnil. Now I would request Dr. V.V. Chinivalar sir to say a few words about the session.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಇಂದಿನ ಈ ಒಂದು ಟಾಪಿಕ್ HPV ವ್ಯಾಕ್ಸಿನ್ ಅಗೇನ್ಸ್ಟ್ ಕ್ಯಾನ್ಸರ್, ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ನಿಜವಾಗಿಯೂ ಒಂದು ಒಳ್ಳೆ ಟಾಪಿಕ್ಕು. ಸೊ ಈ ನನ್ನ ಒಂದು 45 ವರ್ಷದ ಸರ್ವಿಸ್ನಲ್ಲಿ ನಾನು ನೋಡ್ಲಿಕ್ಕಾಗಿ ಸಾಕಷ್ಟು ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ಸು ಏನಂತಲ್ಲ ನಮ್ಮ ಪ್ರಾಕ್ಟೀಸ್ನಲ್ಲಿ ನೋಡಿದ್ದೀನಿ. ಅಲ್ಲದೆ ನಮ್ಮ ಮನೆಯಲ್ಲಿಯೇ ನನ್ನ ಅತ್ತೆ ಮತ್ತು ನನ್ನ ದೊಡ್ಡಮ್ಮನು ಸಹ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರಿಗೆ ಬಲಿಯಾದರು. ಸೊ ಇಂಥ ಒಂದು ಈ ಕ್ಯಾನ್ಸರ್ಗೆ ತಡೆಗಟ್ಟುವ ಸಲುವಾಗಿ ಸರ್ಕಾರವು HPV ವ್ಯಾಕ್ಸಿನ್ ಅಂತ ಹೇಳಿ ಇದನ್ನು ಮಾಡಿ ಅದನ್ನು ಎಲ್ಲ ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ಏನಂತಲ್ಲ ಕೊಡುವ ಸಲುವಾಗಿ ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನು ಹಮ್ಮಿಕೊಂಡಿದೆ. ಇದು ಒಂದು ಒಳ್ಳೆಯ ಕಾರ್ಯಕ್ರಮ. ಸೊ ಇಂಥ ಕಾರ್ಯಕ್ರಮಗಳು ಮೇಲೆ ನಡೆದು ಆದಷ್ಟು ಈ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ನ ಆದಷ್ಟು ತಡೆಗಟ್ಟಿ ನಿರ್ಮೂಲನೆ ಮಾಡುವಲ್ಲಿ HPV ವ್ಯಾಕ್ಸಿನ್ಗೆ ಏನಂತಲ್ಲ ಅದಾಗಲಿ ಅಂತ ಹೇಳಿ ನಾನು ಎರಡು ಮಾತುಗಳನ್ನು ಹೇಳಿ ನನ್ನ ಮಾತು ಮುಗಿಸ್ತೀನಿ.
Thank you, sir. Now I would request Dr. Suriraju sir, the Honorary Secretary, to speak a few words.
Last few months and webinars. The most important thing is topic today's discussion is vaccination HPV. As you all aware, the cancer, only cancer vaccination availability is available right now. Virus vaccine, cancer, and second thing is hepatitis B vaccine, hepatitis B virus vaccine. So this is a wonderful topic. As you all aware, even central government has taken initiative for the free distribution of vaccine throughout India. For that, we have to congratulate. At the same time, it is really important for IMA to bring awareness about vaccine to the public, and important for us to undergo the training and motivate people to women take the vaccines. So I hope this program will be helpful and motivate others to go for vaccination. I had to congratulate organizers and Dr. Padma Prakash Madam, Dr. Ramesh, and Dr. Vinaya Srinivas Madam, and all the MSN body for conducting such. I am hoping that this program will motivate others for vaccination. Thank you.
Thank you, Suriraju sir. Thank you, Suriraju sir and Srinivalar sir for such insightful words. Now I would request Padma ma'am to introduce our speaker for the day.
Thank you. Once again, hearty welcome to all of you, President, Sir, Secretary, and the guest speaker of today's program, Dr. Bharti Rajshekar ma'am. Dr. Bharti Rajshekar, she's a President KSOG. She's a chairperson of FOXY, Perinatology Committee 25 to 28. She's a President of Karnataka State Obstetrics Association, Chairperson, FOXY, Perinatology 25-28. She's MD, DGO, FICOG, and FKCOG. She's worked in her own hospital called Bharti Nursing Home. Now it is turned into Sahyadri Multi-Speciality Hospital at Hassan. She's a director of Indian Red Cross Hassan, KPMEA State Vice President. IMA, she was the past Vice President of IMA KSB. IMA Women Doctors Wing EC member. At Hassan, she's a past President of HSOG, Hassan Obstetrics and Gynec Society. Past Secretary of Hassan.
Dr. Padma, I think that's enough.
PCP and DT committee member. Do you deserve all this? Like it's not easy to get so many work done and to hold so many positions. Please, 1 minute, I'll just complete it.
Okay.
She's the chairperson of Perinatology Committee, FOXY 25 and 28. FOXY Public Awareness Committee member, South Zone Coordinator as well. She's a member of Preventive Oncology Committee, faculty in various state and national conferences. FOXY Food, Medical Equipment and Drug Committee member, trainer FOXY Dhira program, trainer FOXY RAC RAC program as well. Her awards and activities, really, I took a lot of time to read about that. She's got lot of awards. Feather to her cap, Dr. D.K. Tank Award, twice as HCOG Secretary and President, President Rotating Trophy as Secretary HCOG, FOXY President Rotating Trophy as President HCOG, recipient of Rajotsava Award for work in healthcare in Hassan, President Medal for Topper in Final MBBS, Madras University. A big round of applause. Actively involved in adolescent health awareness activities. She still conducts first aid and basic life support workshops for public, drivers, and colleges also. So it shows her commitment towards the society to have a healthy society. She's also trying to do HPV screening camps, cancer cervix screening camps, screened around 5,000 women. Please make a note. She has screened around 5,000 women. HPV vaccination free of cost for immune compromised people. Awareness camps on cancer prevention in women also. So really, we are very happy and we are privileged to have you today, ma'am. I've listened to you earlier, so I was so much impressed by your talk. So I thought you are the right person to guide the medical student as well as the doctors who are gathered here today. Please, over to you, madam. Thank you.
Thank you. Thank you, Dr. Padma. That was a very good, warm introduction. My pranams to the President IMA Karnataka State, Dr. Veerbadrappa Chinivalar, who's a very well-known friend, acquaintance of mine in my active days in the IMA, and I intend to come into the mainstream once again soon after I finish my Kasova activities. My pranams to the Secretary, Dr. Suriraju, and all the other office bearers, and my dear, many of my dear friends are over here. My namaskarams to all of you. So without wasting much time, let us go into a very important topic. Dr. Padma, I would like to tell you that this 5,000 screening is from my old resume. And now this year we have done a lot of activities, and in February and January, February in Hassan Society, with the help of the Hema Divakar Rao Foundation and our ex-MLA, Shri A.T. Ramaswamy, we have vaccinated almost 1,800 children for free. Just this month, February, we vaccinated 1,000 children for free. And the previous month, we vaccinated 800 children for free. And we are also doing mammography and the pap smear screening camps all over Hassan district. Very, very energetically. I have a very good team in Hassan who helps me along with this. So let us go into see how all of us can put our hands together to prevent, I think this is my slide, yeah, to prevent cancer, cervix. And it was so disheartening to hear when Dr. Chiniwalar said he had 2 in his own family who succumbed to this very much preventable disease. So let us now see how not only the obstetricians and gynecologists, but also all specialities who come under the IMA, which is our parent body, how we can all start from adolescent period and talk to them about how we could prevent cancer cervix. So I hope my slides are visible.
Yes.
Yeah. So the aim, what is the aim going to be? The aim is going to be to have a cancer cervix Mukta Bharat. This is the aim of the Indian Medical Association as well as all the associated medical bodies under Indian Medical Association. And how can we prevent? We can prevent by screening, detecting, treating, and vaccinating. So my theme was promote wellness and prevent illness, and very pertaining to that very significantly, I think preventing cervical cancer through HPV vaccination is a landmark development which will definitely help our business. Yeah. So does HPV cause only cervical cancer, and why do HPV diseases need to be prevented in India? Well, we know that HPV does cause other cancers, but cervical cancer is something that is very, very predominant in our country. The statistics in 2020, and this year it is even alarming, more than half of the cervical cancers diagnosed in the world occur in Asia. And in that, India contributes to a huge, almost 1 in 4 women who are suffering from cervical cancer are from India. That is, we are contributing to about 25% of the global statistics. Women in India are the contributing. And very sadly, 1 woman dies of cervical cancer every 8 minutes in India. Still, we are just now waking up to this disaster. India has the highest burden, and almost 67,000 deaths occur per year due to cervical cancer. When the COVID-19 epidemic struck us and we lost about 5 lakhs and above, I think, Indians due to the COVID pandemic, everybody was up and against the COVID vaccine, but virus, sorry. But unfortunately, these women have been dying over a period of numerous years. It is like an airplane carrying around 180 women crashing 1,800 women crashing every day in India. So India has a population of around 436.6 million. This is a little older statistics for women aged 15 years and older, and all of them are at a risk of developing cervical cancer. It is the second most common cause of female cancer, the first being breast cancer. And it strikes in the most productive age of those women, that is from 15 to 44 years, it strikes. So as I told you, around 67,000 women are dying annually. So approximately 185 women die every day. That is, there is a plane filled with women crashing every day in India. But unfortunately, it does not make to the headlines. When train accident, there are 4 people dead. There is an air crash and there are 20 people dead. It goes on, and there are analysis, there are criticisms going on about who is to blame. But when this 185 women are dying somewhere in our country today because of cervical cancer, the necessary hue and cry is not there. The necessary discussions are not there. The necessary precautionary steps are still not into place. Slowly, the government of India has woken up. They have announced that HPV vaccination will be given free of cost to the girls from 9 to 14 years. Few states have taken it up. Our Finance Minister, Dr. Nirmala Sitharaman, announced a 12,000 crore budget last year, but I am sad to say that many of the state governments, including our own state, say they have not yet received the budget. And when we spoke to the health minister from the Karnataka State OBG Association multiple times, they have given us promises, but not yet implemented. they say the money has to come from the center. So there have been times when I have spoken to the Chief Minister and the Health Minister and told them, sir, that 2,000 rupees which you have given or the free bus pass you have given could have been utilized to vaccinate these 9 to 14 years children of Karnataka. That would have been a landmark gift if at all you had taken our advice and given it. I hope so. We still have talks with them. We would request them to join us in pressurizing the Karnataka to introduce cervical cancer vaccination free of cost for at least the children of 14 years, so that we catch one group of them before they escape into the society after their school going age. So that's what I want to tell you. India contributes to about 27% of the world's incidence of HPV, of cancer cervix. So, and it has been scientifically studied that the 94.4% of cases of cervical cancer are caused by the HPV virus. So just a brief output of that, the HPV virus is a very small non-enveloped isocohedral DNA vaccine, which is about 52 to 55 types. It has got double capsid protein layers, and there are about 150 genotypes in the HPV virus, but they could be the cutaneous genotypes or the mucosal genotypes. In the mucosal genotypes, we are worried only about the high-risk genotypes, because these high-risk genotypes, that is 6, 11, 16, and 18, are the ones which are going to cause high or low-grade genital tract dysplasia, cancer of the cervix, vulva, vagina, anus, penis, and the oropharynx. The low-risk ones can cause anogenital condylomas, genital warts, or respiratory papillomatosis. And the cutaneous types can cause benign skin warts, keratosis, keratocanthomas, non-melanemic skin cancers. So we are now focusing only on cervical cancer. So how do we prevent this cervical cancer? As I already told you, HPV can cause many more cancers than just cervical cancer. It does contribute to about 13% of oropharyngeal cancers, including tonsils and base of tongues. It can contribute to anal cancers, penile cancers, vulvar cancers, vaginal cancers, but almost 100% of cervical cancers are due to HPV infection. So that is why we are talking about the HPV vaccination, which can prevent this cervical intraepithelial neoplasia developing into cervical cancer, but because there is a very long time frame from the infection of HPV to the development of an intraepithelial lesion and an invasive carcinoma is a period of almost 10 to 12 years, which is the time we can target this virus and prevent intraepithelial neoplasia. And as I already told you, anal cancer can also be caused by HPV, and that is why we are also promoting vaccination for boys. So I'm not going to go into these details now. I already spoken to you about this. Yeah, so the tip of the iceberg we are seeing, we know that cervical cancer, 99% is caused by HPV, but we have to be aware that HPV can also cause cancers in men, like penile cancers, anal cancers, colorectal cancers, and anopharyngeal cancers, because the whole time we are talking about the woman and cervical cancer today, but we need to also focus on the vaccination of the males, because they also are prone to HPV infection causing some sort of cancers, and they can also be the transmitter for HPV once there is sexual activity in the women. So in HPV, we are bothered about the 4 genotypes which are going to cause cervical cancer. Though there are 150 genotypes, we are going to focus only on HPV 6, HPV 11, HPV 16, and HPV 18. And these are the high-risk groups, and HPV 16 and 18 cause almost 83.2% of cervical cancer in India, and HPV 6 and 11 can cause 90% of anogenital warts, according to the WHO studies. So how does HPV get infected? Almost 80 to 90% of us, including many of us, definitely get infected with the HPV virus initially in our lifetime. However, most of the people who get infected have their immunogenicity, which is very strong, and they are able to cause a regression in the HPV infection. But however, when there is no regression because of poor immune response, the HPV will infect the epithelial cells in the cervical mucosa or any other mucosa. The HPV DNA gets integrated, and there are mutations, and that leads to viral replication, just like the hepatitis B, there is an increased HPV in the epithelial cells. More than 90% will heal within 2 years. The remaining progress over a period of 10 to 30 years, causing pre-invasive lesions and pre-invasive and invasive cancers. So only 0.8% will develop cancer, but that itself is a huge burden in our part of the country. So we have this time frame of almost 8 to 10 years where we can target that it does not get replicated. We can arrest the replication and prevent the cervix from getting infected into a precancerous lesion or an invasive lesion. And that is the time that we all need to focus upon. So how does HPV, that is a human papilloma virus, spread? HPV can be spread by skin to skin contact. So it need not necessarily be a sexual contact. Any type of sexual contact, like it could be sexual intercourse, it could be just an anal intercourse, it could be oral sex, or it could be just fondling and kissing, can, because of the mucosa to mucosa contact, can cause HPV infection. It is also passed to a baby at birth. So these are similar to HIV, it can spread. It can be prevented by using condoms, regular testing for sexually transmitted infections and getting them treated, because women and men with sexually transmitted infections have a higher incidence of invasive cancer cervix due to HPV vaccination. Of course, the very, very important element we have in preventing cervical cancer is vaccination. HPV cannot be spread by hugging, holding hands, sharing toilet seats, using swimming pools, sharing utensils, sharing food or hot tubs. So we need to understand it is only by mucosa to mucosa or skin contact. So how do you get this HPV? I told you 2 individuals plus sexual activity could lead to any of these 100 types of HPV vaccination. But we are bothered about the 16 and 18 strains, which are responsible for 70% cases of cervical cancer and a strong proportion of anal, vaginal, and vulval cancers. The 31 and 45, which are usually not covered by the quadrivalent vaccine, are also high risk. They may be responsible, but right now we are not focusing on these strains. We are more focused on the 16, 18, and the 6 and 11, because 6 and 11 strains, 90% of genital warts in males and females are due to the 6 and 11 strain of HPV. And we have lower risk HPV strains, which usually the body clears the infection by itself due to the very good immune response. But however, the immunocompromised people may have difficulties in eliminating this infection. So the WHO gave a global call in the year 2018 that we need to eliminate cervical cancer, just like we have eliminated poliomyelitis or smallpox. So all the bodies got together to bring about a guideline as to how we can eliminate cervical cancer. So it says elimination of cervical cancer as a global health issue is within reach of all countries. We know what works, we know how to prevent it and control the disease. So Australia has been the first country to eliminate cervical cancer, followed by some of the Scandinavian countries where they have less than 4 per 100,000 cervical cancers today. So this was the Federation of International Gynecologists Association. Along with WHO, we made a call for elimination of global cervical cancer globally, and we came up with a strategy of 90-70-90 mantra. So what is 90% of girls need to be fully vaccinated against HPV by 15 years of age by the year 2030. 70% of women are screened with a high performance test by 35 and 45 years of at least twice in their lifetime. They need to be screened by a high performance test that is either a HPV hybrid genomic testing or a liquid based Pap cytology. And 90% of women identified with cervical disease receive appropriate treatment for precancerous lesions or invasive cancers. So the SDG goals say that by 2030, we have to achieve these goals of a 90% vaccination, 70% screening, and a 90% of proper treatment. So in the Western world, we have seen that they have almost achieved the targets. 50 to 90% vaccination has been taken place. 80 to 90% of women are screened, and almost 90% receive the appropriate treatment. And many of the Western countries, if you have not got your pap smear done, if you're not vaccinated, the insurance does not cover you. So that is the one of the things, the strategies I think we need to take up when we address the issue in India. But what is happening in India? It's a very dismal scene here. Less than 1% of our girls are vaccinated. We hardly have about 3 to 5%, I would say now, who are screened by a high performance test, and only 10% come to us at the appropriate time to receive appropriate treatment for pre-invasive and invasive lesions. A very, very sorry figure indeed. And why is this happening in India? Why are women dying because of cervical cancer in India? I think, do you think it is because just lack of infrastructure? Well, I would say it is multifactorial. Why is it multifactorial? Well, every 7 minutes, I'm telling you, a woman is dying of cervical cancer, but there is a lack of awareness among both educated and uneducated population in our country. Very sadly, to say, many of our healthcare personnel themselves would not have been screened for cervical cancer or do not come early when they develop a lesion. And of course, vaccination, most of them are getting their children vaccinated today. The other is a lack of commitment about the healthcare providers. We do not talk about cervical cancer. We do not talk about vaccination. We do not talk about screening. Every clinical practitioner, for whatsoever reason a woman comes or a man comes, they need to talk about cervical cancer screening, breast cancer screening, so that if it's a man who has come, he carries the message to his family, the women in his family. If the lady has come, and she may be a menopausal lady, she may have come for diabetes checkup, she may have come with a grandchild. The moment you tell them there is something like this, they will go home and talk about this disease, and they will talk about the screening modalities, they will talk about the vaccination, and the message will be throughout, it will percolate throughout the society. And lack of infrastructure, I think nowadays that should not be a factor. But of course, I would say in most of the public sector hospitals, there is a huge deficit in healthcare resources. There is human resources deficits are there, and with the huge burden of the workload there, they fail to do proper counseling, or they don't have the time, or they don't have the human resources for that. And of course, very often the facilities to do a HPV test or the facilities to do a pap smear may be there, but they don't have the human resources, which is a very, very important factor. And I think this is where the Indian Medical Association should come in, so that we can train our healthcare workers, like the ASHA workers could be trained to do an examination. The healthcare workers like the ANMs and the nurses can be trained, so that the burden on the medical practitioners, that's the doctors, can be reduced. So this is where, as I told you, an Airbus full of women is crashing every day in India. And these women are all in the reproductive age group, and they are just suffering just from cancer cervix, leave alone those women who died due to maternal mortality or due to other non-communicable diseases. So this is what I wanted to tell you. The HPV burden in India, you see, 1,23,000 women are infected every day in cervical cancer. The others trailing behind, you can see the others. I'm not going to highlight. And when we see the HPV infection prevalence, it is quite rampant in these women. So HPV disease, I told you, may also lead to a significant psychological impact. Because as soon as we diagnose that they have some sort of a pre-invasive lesion or they have an invasive cancer, they need treatment, the huge impact not only on the woman, but also on her family and society at large. And it is a huge drain on the health resources, because our health, the allocation of health funds in our state as well as our national budget is dismally poor. This is again where I think IMA and all the official bodies have to put our hands together and say, we need a better health budget. We need more resources to prevent these preventable diseases. So how can we eliminate cervical cancer according to the SDG goals of 90, 70, and 90? So one is lifestyle modification. The second is regular screening and vaccination. Today, my talk will pertain mainly just to vaccination. So Cancer Cervix Mukta Bharat, we can prevent primarily with vaccination and detection by screening. So the primary modality is going to be vaccination. The secondary modality is going to be by screening. So HPV vaccination is definitely a path to a bright future, because as I told you, the number of women dying because of cancer cervix is very high. And we need to understand that cervical cancer is one and only disease that can be vaccine preventable. It is the only malignancy which has a vaccine, and it can definitely be preventable, because these vaccination protocols which have been used in the Western world have shown that there is a significant decrease in cervical cancer and cancer cervix can be eliminated. So who has to get it? Why, when, where, and what is what we're going to answer now. So how does the HPV vaccine work? The vaccine is introduced as a viral live protein into the body. The body produces antibodies to these viral proteins, and these viral proteins, when HPV enters the body, these antibodies will cause an immunological reaction and remove the HPV infection. So that is just like any other vaccine which acts, as I told you. This I've already spoken to, so I'm not going to talk about the inflammation, the amplification, and then the viral persistence. So that is how the vaccine infects us. So then we have to eliminate this by primarily preventing the replication of the viral DNA in the mucosal cells, which later on could lead to pre-invasive lesions, and then after a period of 7 to 8 years into an invasive cancer. So primary prevention is the most important step, and it is recommended for both boys and girls. I need to highlight this because as of now, we are focusing on the girls, but we have many boys in our country which also need to be protected. So the vaccine has to be advised for boys and girls according to the WHO guidelines, the CDC guidelines, the Government of India guidelines. Though we are focusing on women, we need to focus on the boys also. So we have to start talking very early. That is, the ideal dosage, the time would be ages 9 to 10. If you're giving it on time, it will be around 11 to 12 years. And late catch-up dose will be around 13 to 14 years. And very late is going to be the age from 15 to 26. So ideally, we should start vaccinating from the age of 9 till the age of 26 years. So start talking early. So from 9 to 14 years, it is going to be 2 doses. That is 0 dose and another dose at 6 months. However, for those children who are going to take the vaccination after the 14th birthday, up to the age of 26 years, according to the WHO guidelines, we are going to give them 3 doses. That is a 0, a 2 and 6 month dose. So this is a universal protocol. So about 80% of people do get they are infected with HPV. So recommending HPV vaccination for all 11 to 12-year-olds can protect them long before they are even exposed. That is why we ask them to take an early vaccination. And of course, our Federation of Obstetrics and Gynecological Society recommends the vaccine up to 45 years. However, after proper counseling and informed consent, that the efficacy of the vaccine may not be as efficacious as the early dosages that we are given. And it has proven that giving this vaccine at the early age, there is a breakthrough of the immunogenicity, and that can last up to 45 years, so you can give it. So which vaccine do I give now? So we have 3 types of vaccine. We have 2 types of vaccines right now. That is the quadrivalent vaccine and the nanovalent vaccine. The quadrivalent vaccine will cover for 6, 11, 16, and 18 genotypes, which are the high-risk groups. And that we have, one is a Cerevavac, which is made in India by the Serum Institute of India for the past 2 to 2.5 years. Following the COVID epidemic, we have started having our own indigenous Serum Institute of India vaccine, which is Cerevavac, which is a quadrivalent vaccine. And it comes in a single dose vial and a 2-dose vial. Then we have the Gardasil, which is an imported vaccine, which is again similar to Cerevavac. You have the Gardasil Quadri, which covers 6, 11, 16, and 18, again the quadrivalent. And we have the Gardasil Nano, which along with 6, 11, 16, and 18 covers few more genotypes of the HPV vaccination. So what are the FDA approved HPV vaccine? The Cervarix is no more in the market. This was an imported vaccine. This is no more in the market, so it is withdrawn. The Gardasil quadrivalent is similar to the Cerevavac we are having in India. Covers again 6, 17, 16, and 18. 6 and 11, which cause genital warts. 16 to 18, which causes cervical invasive and pre-invasive lesions. Given for males and females from the age of 9 to 26 years. Then we have the Gardasil 9, which is a monovalent HPV vaccine. It covers 16, 18, 31, 33, 45, 52, and 58. So it covers 3, 6, 7, 8, and 9. So this is given for males and females from the age of 9 to 26 years. So you always give the choice of vaccination to the individual asking for it. You tell them, in market, we have Cerevavac, made in India, quadrivalent. We have Gardasil, which is an imported vaccine, a little more expensive, but the same efficacy as Cervavac, has the same efficacy as Gardasil quadrivalent. Studies have proven that that is a quadrivalent. And some people go ahead and say, no, doctor, I hear there is a vaccine for 10,000 rupees. I want to take it. Fine, if you want to take it, you can take it. It is a quadrivalent, it's a monovalent vaccine, and they have to take the dosage similarly 0, 2, and 6 if they are above 15 years. And if they are 9 to 14 years, they take 2 doses. So which vaccine? You give the choice to them. They can choose between the 3 vaccines. Today, I had a family come to me and told me, doctor, we have come for the vaccination. My friend's daughter in Bangalore has taken this something called 11,000 rupees, and they told me it will prevent all cancers. See, they don't listen to what the doctors talk. I said it cannot prevent all cancers. It can prevent cervical cancer, to some extent, oropharyngeal and penile cancers, and this is the cost. We have Cervavac, which is 2,000 rupees. The same quadrivalent, we have the Gardasil, which is a little more expensive. I think 3,500, or I'm not sure of the cost. So when do I give the vaccine? I already told you. Vaccine schedule, 9 to 14 years, whether it is your quadrivalent Cervavac, quadrivalent Gardasil, or your monovalent Gardasil, it is going to be 2 doses. Dose 1 is 0 month, and the second dose will be given at 6 months, not 12 months, 6 months. Above 15 to 26 years, it's going to be a 3-dose series. You give 0, then 1 at 2 months, and 1 at 6 months. So these are the 3 doses. And you need to understand that if a second dose is given earlier than 5 months after the first dose, a third dose is needed at least 4 months. So you have to see that if the first dose of any type of vaccine is given before the age of 15 and 6 months have passed, only a second dose is needed. You need not give a third dose below the age of 15 years. And the monovalent vaccine also has to be used in the same timing schedule. So this is our FOXI, that's the Federation of Obstetrics and Gynecology. We have this good practice guidelines about HPV vaccine. So as I told you, 2 doses, 0 to 6 months, 3 doses, 0, 1, and 6. We are giving only the quadrivalent. And evidence says we have grade A strength of recommendation for this vaccine. Then we have a catch-up vaccination that is from age 15 to 26 years. You give them 3 doses. Girls and women who have been sexually active should be counseled regarding the reduced efficacy and importance of screening from the age of 25 to 30 years. And I need to reiterate here that though all the girls are vaccinated with HPV, you need to tell them, irrespective of whichever vaccine they have taken, they have to get a screening of cervical cancer and breast cancer from the age of 25 or 30 years, at least twice in their lifetime, preferably every 5 years up to the age of 60 years. Older age group that is more than 26 years, you could definitely give them a vaccine. It has to be a 3-dose vaccine. For women aged more than 26 years who have been sexually active, they should be counseled regarding the reduced efficacy in the older age group and the importance of screening for cervical cancer. You have to tell them that you have to get your screening done. And after your screening is done, you can get the vaccination in these sexually active women. So I've already told you 1 + 2 is equal to 6. It protects against 6 types of cancer. And pediatricians also need to start talking about this vaccine. And HPV vaccine is best at 11 to 12 years. Ensure immunization is completed prior to potential exposure. So this is where our pediatricians can definitely rope in and advise vaccination, because as we have seen in clinical practice, when the pediatrician advises the vaccination, they are more compliant rather than, because by the time they come to an obstetrician or a gynecologist, their mindset about vaccination has changed, but it takes a little more time and a little more effort from us to convince them to get the vaccination. However, when the pediatrician informs them at the age of 9 to 11, they are very, very compliant and they 100% take the vaccination. So why we give them early vaccination is because studies have shown that antibodies produced are highest between the ages of 9 to 15 years. And these are the time when we can get the maximum immunogenicity. So what are the most important reasons for concentrating on adolescents? There is a higher immune response in adolescents versus young adults. There is a high risk of acquiring HPV infection even with their first male partner when they become sexually active at the age of 18. Immunizing before exposure can give the highest possible efficacy, and cost of immunization is brought down drastically because less than 14 years, they need just 2 doses. So these are some of the tips and the keynotes we could use while we are vaccinating these children at 9 to 11 years. And studies have shown that those who were vaccinated before the age of 17, they were having a higher immunogenicity than those who were vaccinated after or who are not vaccinated. That is why let us try to catch them early, because it has shown that exposure to HPV at a young age increases the cervical cancer risk. So let us catch them even before they get infected with the HPV. So we have to start very early. So as I told you, Ceravavac is our own indigenously made in India product. It is a quadrivalent vaccine. It is effective against all the 4 high-risk variants of the HPV virus. And this is what I am using personally in my clinical practice. For the past, soon as and when it was introduced, I have already taken up this Ceravavac, and it is economically feasible, easily available, and made in India. And studies have proven that its immunogenicity is on par with any of the imported vaccines which are available. So in special situations, most of you will have questions. What do I do if it is a HIV positive or an immunocompromised girl? So it says that the same age recommendations, that is 9 to 26, has to be given. However, we are giving 9 to 14-year-old children 2 doses in case they are not immunocompromised. If they are immunocompromised, you have to give them 0, 2, and 6. This is one change. If you see HIV or any immunocompromised children, you have to give them 3 doses, even if they are less than 14 years. What happens if there is an interrupted dose? For example, they miss the dose, or they become pregnant at 18 or 20 years, you can continue with the remaining doses. You need not restart. For example, if they've taken the 0 dose and the 2 dose at 17 years, she gets married and she becomes pregnant, she misses her 3rd dose, she can deliver the child, and then in the postnatal period, she need to take only the missed dose, that is the 3rd dose. In case she has taken only 1 dose and for some eventuality she has forgotten for the next 6 months, she can restart and take the 2nd dose and the 3rd dose. It need not be restarted from the beginning. Pregnancy and lactation, the vaccine is not to be given in pregnancy. However, if you have given a vaccine in the first, just preconceptionally or just in the first few days of her missed period, you don't know she has missed her period, there is no necessity to advise a medical termination of pregnancy. She has taken vaccination in the first few weeks of her pregnancy. You need not advise an MTP. She can continue the pregnancy. The strength of recommendation is grade B. It can be given in so that's the point where we try to say that try to talk about cancer cervix when immunization in the when we're talking about the child's immunization in the postnatal period. Then, of course, victims of sexual abuse rape, same age recommendation, but however, give them 3 doses. Women with history of abnormal screening reports, for example, they have an abnormal pap smear like a low squamous cell intraepithelial lesion. The recommendations of age are the same, that is more than 26 years. It is 3 doses. However, you have to stress the importance of a regular follow-up.
Madam got disconnected.
ಹೌದಾ? Shall I call her?
No, she's joining back.
Has she joined or shall I call her, John?
Just call and see, ma'am. Ma'am joined. Her audio is not connected.
Yeah. Now?
Okay, yes,
Hello?
ma'am.
I'm sorry,
You're
sorry.
audible now.
Yeah, my network. Let me go back to the share, okay? Just a few more, yeah. Just a few minutes I have.
If you don't mind, ma'am, I will off the video so that you can get the good network.
Yeah, just a minute, sir. Just let me go back to where I started. I've just got a few more to. I'm always done.
From here only, ma'am.
Yeah.
Next.
Yeah, this is where I am.
The next.
Yeah, I'll put off my video. Okay. So as I already told you, sorry. So this is a GCPR recommendations. And then is it only that the girls need the vaccination? So I would say definite no. We have to talk about HPV vaccination to our boys also. We need to recommend the vaccination for boys also. Why is it important that we protect boys from HPV? It is because the HPV related cancers and diseases in males and females are quite significant in our society, and males can also have HPV infection, and they can also be prone for penile cancers, oropharyngeal cancers, genital warts, and they can be the transmitting agent of HPV to their sexual partners. That partner 60. However, we need to vaccinate the boys too. So that is why male HPV vaccination is important, because males remain susceptible to HPV infection throughout the life. So there has to be a gender neutral HPV vaccination in our routine practice. That would be a very prudent decision. And this is the target group. The vaccinations are going to be according to the same schedule as we do for the girls. And the quadrivalent vaccine is given. Less than 14 years, 2 doses. 15 to 26 years, it is going to be 3 doses, because in men it can cause oral cancers, penile cancers, genital warts. So the role of OBGYN, all of you know that we are at a situation where women will listen to us and adolescents come to us for problems when we can talk to them. But I would say I recommend all doctors, irrespective of your specialty. You're a physician, you're a geriatric specialist, you're an orthopedician, you're a pediatrician, doesn't make a surgeon, it could be anybody. Please take time to talk or have some posters in your clinic, have some handouts in your clinic, and see that you create awareness. Let us all join hands together so that we create awareness first among our own fraternity. Tell them about the safety protocols, tell them about the dosage, when to give, how to give, and vaccinate, so that we reach the target of vaccinating 90% of our children by the age of 15 years. And do not forget to tell them that they need to get a screening. So screening could be by a simple Papinicola smear test or even a visual inspection with acetic acid in resource poor conditions. But ideally, we would like to do a human papilloma virus screening test, because in that we can know the genotypes, but do they have the high risk genotypes like 16 and 18, and then we know that this lady has to undergo a colposcopy, she will have to undergo a biopsy if necessary, and she will have to undergo some ablative measures if she has a lesion, so that the pre-invasive lesion is removed. She will not develop invasive cancer, and she will not have to undergo the whole trauma. Not only she, her family, as well as the treating clinicians have an extreme level of trauma and psychological upsets when we are treating a cancer patient. So we have to give them the ablative measures to prevent invasive cancer, to prevent invasive cancer. So cervical cancer is one of the few cancers with which vaccination can eliminate. So let us empower all these boys and girls for a lifetime of well-being. Let us all put our hands together. So I told you, secondary prevention is lifestyle modification and screening, which I will not be talking, but I can take your questions if you want to do. Just for completion's sake, I told you, visual assessment of the cervix, a papinicular smear, or if you have resources, a HPV DNA test. It is not 2,000 to 4,000. We are right now doing it at a price of 1,000 rupees, and we are getting the DNA test, HPV DNA, which is the specific test we are supposed to do to identify. It can be done once in 5 years up to the age of 65 years. So I'm not going to elaborate on all these things. So I've just put it there for completion's sake. Is it possible in India? Definitely possible in India. Let us all put our hands together to see that we have this 90, 70, 90 on our scales again. And let us all put our hands for a cancer cervix, Mukta Bharat. So why talk of cure when we can prevent the cervical cancer? It is 100% preventable cancer. And we wish all of you to become an ambassador to join this movement. We want all of you to create awareness about vaccination, screening, early detection, and vaccination. So let's join our hands together for Cancer Cervix Mukta Bharat. And I thank the Karnataka State IMA for taking up this very, very important topic today, so that all of us get informed and give a gift of a great future to the children around us today and make this world a better place to live. Thank you very much.
Thank you so much, ma'am, Dr. Bharti Rajshekhar, for sharing your valuable expertise with us. I think among doctors only, many of us would have not taken the vaccine.
Yes.
So importantly, we have to spread
Please
the
take
knowledge.
it tomorrow, Dr. Padma.
Definitely, ma'am, definitely. So first,
Yes.
we being doctors, first we have to take the vaccine. And of
Yes.
course, when we come across a patient, every doctor,
Screening.
as you said, whether it's a physician, a pediatrician, orthopedician, surgeon, when we just give them the awareness, at least they will just go and discuss, they come back to us for the vaccination. We really appreciate from MSN, IMA, KSP, we appreciate your insights, really very valuable. And in spite of your busy schedules, you just took time out of it and you just narrated so well, because IMA, KSP, Chamrajpet from MSN, we just vaccinated around 300 people latest 15 days ago. So their query, we had doubts that what about the one patient had, I think one shot taken. So whether second, we have to restart or we have to give the second and the third
don't
dose.
restart. You take up from where she has discontinued.
Yes,
so if she's
ma'am,
taken
that's
one
what we
shot,
did.
you give her only 2 shots at one shot today and then one after 6 months. If
Yes,
they don't
ma'am, that's
remember
what we
the dates, give them 0 and 6.
Yes, ma'am, that's what we did.
For
So,
0 she has taken. So 2 and you can give her the second dose, and 4 months later give her the third dose if she's above 15. If they are
Yes,
below
ma'am.
15, just give them 1 more dose. That's it.
Only 2 doses.
She had taken her first dose in 2019, Bharti. So
then you can start. You can just give her two more doses.
Second dose.
Yeah, second
and
dose.
third dose needs to be given after 4 months.
And there is another WHO SAGE study which has shown that in low middle income groups where finance is a problem, even a single dose of vaccination from the age of 9 to 20 years has proven a good immunogenicity. So even giving a single dose is good enough. So that has been done in very many
results
countries.
Are awaited. But the results in India
results have been published. Some of the results have been published, Anuradha. There are published reports.
But from the government, we need the...
Not from government. It is not recommended in Government of India guidelines, not by the FOXI guidelines, but it has been recommended by the WHO. WHO recommendations are already in place.
In India, we have still not.
Government of India has not issued the guidelines. FOXI has not issued the guidelines. But WHO's guidelines are already there in the WHO website. The SAGE study. The SAGE study single dose, of which Dr. Shankar Narayan has been the director for that study. And the results have been published.
But when asked, we are supposed to say that we continue with the same.
You have to tell them there are no Indian guidelines. No. World Health Organization guidelines are there. Probably in few months it may come.
May I come in?
Sir.
Government of Karnataka has introduced it, and they have announced in budget also this year. They're going to immunize the prevalent people in Kalyan Karnataka region.
They have announced for a few days back that 14-year children will be vaccinated. That was one of the proposals we had given them. I had told them that, told the health minister and the chief minister that, sir, you take the statistics of the 10th standard, the children who are entering 10th standard this year, that is 14-year-old children, and a blanket vaccinate all of them with 2 doses. If you don't have funds now, then next year you take the 14-year-old. So as they come to 14 years, then maybe when the budget comes, they can vaccinate everybody. So I think this year they have said they are going to allocate about 300 crores or something, and they're going to vaccinate the children of 14 years. That is what they have announced last week. But I think we have to put a lot of pressure on them still to implement it. Dr. Srinivalar, we request you, we will be meeting the health minister on the 26th of this month. We have a meeting.
Not audible, ma'am. I think some network issues. Because madam has got a lot of experience.
Dr. Hema Devakar's foundation and all of us are there. So we want them to see that it's implemented this year. Given them the advocacy report, we have given them the statistics, we have provided them with everything. We only want them to roll out the program. And so IMA, KSP has a big role to play over here for us. And Foxy has also brought out the training program, which we are going to train all our IMA doctors about how to create awareness about cervical cancer vaccination. And Dr. Anuradha is in the convener of that program. All over India, this is going to take place.
Thank you, ma'am. Really, we appreciate your insights, which are really valuable. And you got a vast experience in this area also. We are honored to have you on this program. Any questions from the audience? Aditi?
Yes, ma'am. Now the panel is open for any questions. So seeing that
Dr. Suri Rajavi here.
Oh, sorry, sir. Yes,
Madam,
sir.
Madam,
Yes,
I very nicely, very beautifully you have given presentation, madam.
Thank
You told vaccination in boys.
Yes.
This HPV means vaccination is helpful. You told, no, madam.
Yes.
So it is an alternate. Means it is a choice or is it a compulsion?
Yes, it is. No, see, we have to tell them the protocols of vaccination. That is our duty. And I am vaccinating the boys who come to the parents who bring. I tell them to get their boys vaccinated, and I give them the handouts. I tell them your boys need to be vaccinated and why they need to be vaccinated, and the choice is theirs. See, any vaccination, even if the girl wants to vaccinate, it is by choice. We cannot enforce the vaccination on any of them.
Okay.
But it is a necessary vaccination. And Western countries, boys are being vaccinated. And you need to tell that boys need the vaccination too. And the reasons why they need it, I have already enumerated. It's not only...
In India, the recommendation for boys is yet to be released. So till that time, it is mutual consent and we are giving the vaccine. Once the recommendation comes, we can openly tell that there is recommendation, go ahead with the vaccine. Now it is only consent.
But Anuradha, the Foxy guidelines are advising for males also. The government of India as such has not brought in the guidelines yet.
Foxy has not yet released, isn't it, Bharti?
The recent GCPR by Dr. Priya, they have introduced WHO guidelines and it is given all over. So there's no harm in
giving.
I am vaccinating, informing them and giving them the vaccination.
Madam, for boys, the recommended vaccine dose is same, 0
same, sir, similar, same dose.
Doses.
9 to 14 years, same quadrivalent 2 doses. Above for 15 to 26, 3 doses, quadrivalent.
3 doses.
Yes.
So for male and female, both
the same dosage. Same dosage. No changes.
Madam, is there any adverse reaction following vaccines?
I have given thousands of vaccines, so till date, touch wood, I have no adverse reactions. Absolutely nothing.
Okay, ma'am.
We have not had. See, last few years back, there is about 7-8 years back when HPV vaccine was introduced, there were 2 or 3 some deaths which were in Andhra. They were not related to the vaccine. One was a suicide. The other one was some other issue. And they just coincidentally tagged it on to the cervical cancer vaccination. And those have all been disproven now. And Dr. Anuradha, myself, many of our colleagues have given thousands of vaccines. In private, in camps, we have not had any adverse effects. It is absolutely safe. Even pain is not there. There is no pain. There is no giddiness. They say they may have pain or giddiness, but I have not come across. No fever, no body ache, nothing.
Even for me, not one single patient has called up the next day telling that she had pain. And when you go back also after the first
fever.
dose, whatever it is, no
Yes.
pain, no nothing. But to be on the safer side, in the camp, we are supposed to have
we have a consent form. We have a consent form. We make them sit for 10 minutes and tell them that in case we have a contact number, in case you have any problem, just call us. Because coincidentally, they may develop fever due to a viral infection, or they may have acute gastroenteritis due to some food they have eaten. But they will say, I took the vaccine. So we have to be ready to answer their questions and give them the first aid. And in camps, when you are vaccinating, we have to have the first aid protocol in place. We have to have an emergency ambulance in place, because you don't know, it may be a vasovagal attack, or it may be hypotension, hypoglycemia. So we cannot afford to make such mistakes when we do large scale camps of vaccinating 500 to 1,000 people. So in those camps, we have to first create awareness. Just don't have a blanket camp. We create awareness, tell them why we are giving the vaccine, what is the implications, what are the problems associated with HPV infection. We take a consent form, we take the age proof that they are above 9 years, and then only we give them the vaccine. So that makes it a very safe practice. That makes the vaccine popular.
And also in our setups, in our hospitals and clinics, we should make sure that they hang around, they stay in our center.
They stay for about 20 minutes, 15 to 20 minutes.
Yes. So what happens is, by default, if there is anything, that itself will get carried by, as Bharti put it just now, unnecessarily the vaccine will get negative marks. So to avoid that, again, we'll see to it that they stay in us places for some more time. Ideally, make them lie down or
just wait around. Wait in the waiting room for 15-20 minutes. Take a tender coconut or eat some biscuits or banana and then go home.
Second thing, madam, no need of maintaining the.
Maintaining? Sir, documentation we have to maintain. When they come to our clinics and ask for the vaccine, it is an implied consent. So we don't have any consent form for that. But we have a register, we maintain the register when they took the first dose, second dose, and we give them a vaccine card. And we give them a contact number in case of any emergency to contact us. But when we are doing it in camps, that time we have a consent form where the parents put their signature.
Consent, then administration.
Yeah, that is there when awareness, the consent in camps. In clinics, we don't need a consent form. But the moment they come to our clinic and ask us for a vaccination, it is an implied consent. But you document it in your outpatient record and have a register for your own references. And the vaccine comes with a sticker. The Ceravavac vaccine has a sticker batch number. You put it on the vaccine card. You stick that sticker on the vaccine card and send them home. So if there is any spurious problems, we can trace it back to the batch number.
Dr. Suri Raju was asking a question. I think that's the question that he asked.
That was, I think he wanted. That was what his voice was breaking.
Shall we conclude the session? Any questions from the audience?
He wanted to know cold chain maintenance.
Cold chain. Yes, sir. Cold chain maintenance is very, very important. -4 to 8 degrees. So when we keep it in the refrigerator before you give it, and just soon as when you're giving it, you bring it out of the refrigerator and give it to them. Do not store it in the door of the refrigerator. Do not store it in the freezer. And when you're taking it in camps, we do take it in the cold chain containers. We take it in the cold chain containers. We keep them in the ice box and we vaccinate. The cold chain has to be maintained. And regarding this also, sir, in the next training sessions, we will be having how to store the vaccine. Also, we have the guidelines for that also. Okay, and of course, they say that though the vaccine has to be, cold chain has to be maintained, if you have just kept it about outside for 1 or 2 hours, it does not alter the viral immunogenic potential. But ideally, we keep it in the freezer box. We keep it in the freezer box in the camps, and in the hospitals, we keep it in the refrigerators.
Aditi?
Any other questions?
Yes, ma'am. So any other questions or do we proceed?
I think we'll conclude, no?
Yeah.
Yes, ma'am.
Dr. Vinaya
Okay.
Srinivas is there? Dr. Vinaya, vote of thanks from your side.
ಮೇಡಮ್ ನಾನು ಡ್ರೈವ್ ಮಾಡ್ತಾ ಇದ್ದೆ.
ಪರವಾಗಿಲ್ಲ. ಆಗತ್ತಾ ಇಲ್ಲ ಆದಿತ್ಯ vote of thanks. Aditi, go ahead.
Ma'am, I would like to call upon Tanushree to give the vote of thanks.
Yeah, okay. Go ahead, Tanushree.
Good evening, everyone. I am Tanushree, the co-convener of IMA MSN subcommittee, and it is my great honor to deliver the vote of thanks for today's session. I would like to start by giving my sincere thanks to IMA KSP President Dr. V.V. Chiniwala sir and IMA KSP Secretary Dr. Suriraju sir for taking the time out of their busy schedule and giving their valuable insights on today's session. A huge thank you to today's guest speaker, Dr. Bharati Rajshekhar ma'am, President Kesoga, for the informative session that was conducted. I would like to express my gratitude to MSN KSP Chairman Dr. Padma Prakash ma'am and IMA MSN KSP Coordinator Dr. Vinaya Srinivas ma'am for organizing this session. I would also like to express my thanks to MSN National and KSP member Dr. Anuradha Parmesh ma'am, Dr. Madhusudan sir, past President IMA KSP, Dr. Yogananda Reddy, President-elect IMA KSB Dr. Veerabhadra sir, all senior doctors and medical students that have attended this session. I am sure we have all gained a lot of information and awareness, and we look forward to do more such sessions in the future. Thank you.
Thank you. Thank you and good night.
Thank you, one and all.
Thank you, Tanushree. Thank you, ma'am.
Thank you,
for
Bharti
the
ma'am.
opportunity. Bye-bye. Thank you.
Thanks,
One,
Bharti.
madam, one request
Really,
to
sir.
all the lady doctors.
Really, sir.
On 16th January, March, at Davangere, there is a WDW conference. Please, you attend all. And also
Which day, sir? March?
motivate others to attend.
Month end.
Sunday,
16 ಮಾರ್ಚ್ಗೆ ರವಿವಾರ
16 ಮಾರ್ಚ್ ನಾನು ಲಕ್ಷದ್ವೀಪಲ್ಲಿ ಇರ್ತೀನಿ ಸರ್ ನಾನು. We are going to Lakshadweep tomorrow. I'm sorry about it.
Otherwise, you motivate other colleagues.
Yes, sir. Sure, I will tell the others. Thank you.
ಕರ್ನಾಟಕ ರಾಜ್ಯದ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಮಹಿಳಾ ವೈದ್ಯ ಘಟಕದ ಸಮ್ಮೇಳನ 16 ಮಾರ್ಚ್ಗಿದೆ. ದಯವಿಟ್ಟು ಎಲ್ಲರೂ ಅದಕ್ಕೆ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡ್ರಿ. ಅದನ್ನ ರಜನಿ ಅವರ ಅಧ್ಯಕ್ಷತೆಯಲ್ಲಿ ನಡೀತಾ ಇದೆ. ಸೊ ದಯವಿಟ್ಟು ಎಲ್ಲರೂ ಇದಕ್ಕೆ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡಿ ಯಶಸ್ವಿಗೊಳಿಸ್ಬೇಕಂತ ನಾನು ಕೇಳ್ಕೊಳ್ತಿದ್ದೆ.
ಖಂಡಿತ ಸರ್. ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ.
Thank you.
ಬರ್ತಿರಲಿಲ್ಲ ಮೇಡಮ್ ಪದ್ಮಾ ಅನುರಾಧ?
ಸರ್ ನಮ್ದು ಯಲಹಂಕದಲ್ಲಿ ವಿಮೆನ್ಸ್ ಡೇ ಸೆಲೆಬ್ರೇಷನ್ ಇದೆ ಸರ್ 16th ಸಂಡೇ.
ಪೆನಾಲ್ಟಿ ಹಾಕ್ಬೇಕಾಗತ್ತೆ ನಮಗೆ. ನಿಮ್ಮ ಸಲುವಾಗೇನೆ ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡ್ತಾ ಇದೀವಿ. ನೀವು
ಅದು ಕೋಇನ್ಸಿಡೆನ್ಸ್ ಆಗ್ಬಿಟ್ಟಿದೆ ಸರ್. ನಾವು ಮಾಡಿದೀವಿ, ಅಲ್ಲಿ ಆಗ್ಬಿಟ್ಟಿದೆ. ಎರಡು ಜಸ್ಟ್ ಕೋಇನ್ಸಿಡೆನ್ಸ್ ಆಗಿದೆ. ಸೊ ಇಲ್ಲೂ ಮಾಡ್ತಾ ಇದೀವಿ.
ಅನುರಾಧ ಮೇಡಮ್ ಬರ್ತಾ ಇದಾರಲ್ಲ
ಸರ್? ನಾನು ಬರ್ತಾ ಇಲ್ಲ ಸರ್.
ಬನ್ನಿ 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 ಬನ್ನಿ, ಪ್ಲೀಸ್ ಕಮ್. ಎಸ್, ಗುಡ್ ನೈಟ್ ಟು ಒನ್ ಅಂಡ್ ಆಲ್.